and expert instructor, you can go through the content wherever you can and whenever you want. Okay. Next, we have live classes where you'll be having in-depth coverage and by your experienced educators, and we'll be getting interactive learning with them. Okay. In express exam modules, you'll be completing the whole syllabus in 20 hours time, that is less than a day, and you'll be taught about answer writing skills, which is more important than your any exams of theory. And it will be, you will be also be given how to write the flowcharts and an effective answer writing way. Okay. And you'll be getting one-to-one doubts clearing session where you will be not judged for your knowledge, and you'll be focused on how the doubts are cleared for you in a simple and confident way, so that you can go to your exams in complete preparation. And you'll be having hard copy book sets where you can learn or go through when you are feeling tired of watching screen for longer time. And you'll be having question banks at 3 levels of expertise, which is from beginner to expert level, and it is more important for your professional exams, NEET PG exams, as well as FMGE exams. And with this, we'll be having practical sessions, so you can gain your extra marks through practical exams, and you'll be given hands-on experiences also. For this, we have 4 types of subscription plans, that is 19,999 for 3 months, and 32,999 for 6 months, and 59,999 for 12 months. And you'll be having a complete MBBS plan that is for 1.9 lakhs. Do not worry about the subscription fees. You'll be getting a good discount codes by using the discount codes below. Okay. With this, we'll be starting with our first question, that is incidence and prevalence, and differentiate with examples. What is incidence? Incidence is a rate. Okay. It is defined as a number of new cases occurring in a defined population during a specific period of time. That means you are calculating incidence for the year of 2024. That means you will be calculating from 1st of January to 31st of December 2024. How many cases have occurred during this 1 year period? You will not take the incident cases which have occurred before 1st of January 2024 and after 31st of December 2024. This is in between these specific fixed time period. Okay. And you will be taking what is the population during that risk. That will be the media population most of the times. That is the risk. Or if you are calculating only for the area of Delhi, you will calculate only the population who are staying at Delhi. Yes, it will be the mobile population, that hence you will take a media population of Delhi. Okay. And it will be always for per 1,000 population. In example, in 2023, there were 15 new cases of dengue fever which were reported in town for 10,000 people. What will be the rate? That is 5 new cases per 1,000 population per year. That is the incident rate. Remember, the 10,000 population will be using the same example for prevalence also. You can see the differences over there. What does incident rate refers to? It refers only the new cases which are occurring during that period. It will not take into account as the previous cases. Okay, during given period. Usually it is calculated for 1 year, and in specified populations or population at risk. Okay. When you take the population at risk, when you are calculating for specific age group, you will take the population at risk. Measles, the exposed population at risk who are not vaccinated. You will not take the people who are vaccinated already. Okay. The incidence rates can be modified as attack rate, secondary attack rate, and hospital admission rate. What is attack rate? Attack rate is also incidence rate. Okay. It is number of new cases specified during specified time interval. Total population at risk at the same interval into 100. Okay. It relates to the number of cases at population at risk and reflects the extent of the epidemic. How fast the infection is spreading. This is attack rate. What is secondary attack rate? The secondary attack rate is a proportion of suspected individuals. who become infected within the defined group. That means there is a case, there are 9 people who are exposed. There are totally 10 people. Out of 10, one is infected and 9 are contacts. Out of this 9, 6 are getting infected. That amounts to 66.7%. This is the secondary attack rate. Okay. 1% develop measles over next 2 years, and 6 more family members become infected, assuming all are susceptible. All the 10 were susceptible without any vaccination. Then the percentage of 66.7% is derived. This is called a secondary attack rate. You don't consider in the denominator of total 10. You will remove the infected person in the first case. What are the uses of incidence? It is used for measuring the risk of disease, like estimating the risk of COVID-19 cases over a year, that is one complete year, and monitoring the disease trends over time for this year, next year, and the other next year. Okay, if there are increase in cases, you can tell there is an increase in cases of particular disease, and if there are decrease in cases, you can say there is an external factor which is acting to decrease the incidence of this disease. It could be a national program, or it could be a treatment program also. Evaluate, that is the evaluating of the effectiveness of interventions, that is by vaccination campaigns or any other immunization or prophylactic treatments. It also helps in identifying the high risk populations. By doing all this, you can plan and allocate your resources of healthcare as per the requirement, or as per the demand, or as per the felt need. And it also helps in research of identifying the causation of disease. And it helps in evaluating screening programs. How? By monitoring the incidence of cervical cancer in populations with or without access to regular pap smear tests. Okay, you can differentiate with them. Then you can actually predict the next burden of these disease in the next years. You can compare the population between 2 different states or 2 different cities, and then you can use them in clinical trials and research purposes also. Next, we have prevalence. What is prevalence? Prevalence is specifically to include all the cases, that is, those who are existing and those who are occurring in new. It includes both. It is the summation of both. It is as simple as that. Okay. There are 2 types, that is point prevalence or period prevalence. What is period point prevalence? It is defined as a number of current cases which are existing at that one point of time. You can ask how many dengue cases are there in India today. That gives us a point prevalence. If you say what are the total number of cases which occurred from 1st January to 31st December 2024, there might be a case which have occurred on 31st of December but still is under the treatment. Even that case is considered. The case has got treated in between March and occurred in March and treated in mid of March. Even that case is also included. Whereas in point prevalence, what is happening today? If the question is today, at that point of particular time, then you can say that these many dengue cases are admitted as of now. You don't take the cases who are all treated or who are all disposed of cases. Okay. In period prevalence, you will take all the treated cases, recovered cases, death cases, whatever the cases existed, and what are the cases existing now also. That is period prevalence. This is the one. Incidence would include the case of 3, 4, 5, and 8. Why? Incidents occurred which has over from 1st January to 31st December. Okay. This has occurred, and sorry, the case 1 is still existing. So it is a long duration. So you can't consider that case. Whereas case 2 has occurred and it has been treated. Whereas at this point of time incidence, 3 were there from this period to this period. 3, 4, 5, and 8 cases are there. This is out of the boundary. These were before the period which they started occurring. When you take point prevalence as on January 1st, there is case number 1, 2, and 7. This is point prevalence. If you take the December 31st, there is 1, 3, 5, and 8. The others are outside the boundary. When you take period prevalence of 1st January to 31st December, all cases come in from 1 to 8. This is the gist of incidence and prevalence. Then this is the example, same 10,000 people population, and 200 were diagnosed with diabetes. So it comes to 20 cases per 1,000 population. Okay, because it is a chronic disease. Differences, the incidence is a new cases and prevalence is summation of cases. Over a specific period of time, it can be point of time or period of time. It measures risk of developing a disease. It measures the burden of disease. What are the relationships? Depends on two factors, that is incidence and mean duration. I into D. This is a formula you have to remember when you are given a practical problem in the practical exams. Okay, for example, 10,000 cases per 10 cases per 1,000 population per year over a period of 5 years, then it becomes 50 per 1,000 population. This is the relationship between prevalence and incidence. This is the diagram which you can use in your exams also. Okay. Uses of prevalence to estimate the magnitude of health disease problems in the community and identify potential high-risk populations. And prevalence rates are especially for administrative and planning purposes. Okay. Next, we have mortality indicators which include crude death rate, infant mortality, and their importance. In mortality indicators, I have discussed all the majority of the indicators. We'll look into it. Okay. These are traditional measures of health status of the community. What is crude death rate? It is a number of deaths per 1,000 population per year. Per 1,000 population per year in a given community. Okay. It just measures how many people are dying every year. It does not, what are the limitations? It does not give you the age and gender composition. It does not reflect any quality of life. The death might be because of infection, or it could be because of accident. It could be because of any other disorder. It does not give you any details. It just says these many were there, these many died. Okay. This is the end of the crude death rate. It can be used as a comparative tool in international comparison when nothing is available. In importance in public health is reducing mortality is the primary goal. You can use it as a measuring tool. Okay. Next is expectation of life. Expectation of life is the number of years a newborn infant is expected. It is an expectation. It is not the reality. If the newborn is born today, how many years the newborn will live for the rest of the, it could be 60 years, it could be 70 years, it could be 80 years. That is the life expectancy at birth. What are the factors which include? Infant mortality rate, child mortality rate, socioeconomic status, lifestyle factor, accessing to healthcare systems, environmental factors like earthquakes, pollution, climate change, disasters, tsunamis, everything. Okay, these are the factors, adverse factors which are occur to the person when he is born. All these factors affect the expectation of life. It can be used as a health indicator. If the expectation of life is more, it indicates the condition is healthy. If it is less, it means the life expectancy is less. That means there is a less healthy conditions, or there could be less healthcare facilities or less quality of life. Okay. Limitations, it only measures the duration of life. It does not measure the quality of living. Okay. Age-specific death rates. It provides more detailed picture of mortality patterns within the population. You can take infant death rate, you can take under 5 mortality rate, you can take adolescent death rate, you can take mid-year adult, that is 20 to 40 years death rate, you can take old age death rate. This is what age-specific death rate means. It is calculated again per 1,000 population of when the denominator is of the same age group. You don't take the mid-year population while calculating under 5 mortality rate. You take the estimated population or the total population of under 5 and how many deaths happened in under 5. Okay. In the same period, in the same area. Importance, it helps to identify which age group age group requires the national program implementations, and you can monitor that. Next, we have infant mortality rate. It is a crucial indicator for population's overall health and socioeconomic conditions. It measures what? Number of deaths of infants under year of age 1 per 1,000 live births, which is less than 1 year age group per 1,000 live births. What does it reflects? The overall health of the country, and it reflects the overall health of the mother. It reflects the overall health of the family, socioeconomic condition, healthcare qualities, and poverty, malnutrition, everything it can be predicted out of this. What does the factors affecting maternal health, birth weight, access to healthcare, socioeconomic factors, and environmental factors? How do we reduce it? By improving the maternal health, promoting breastfeeding, immunization, improving healthcare, and addressing socioeconomic disparities. I have included most of the things in these questions because it will be a revision for you guys when all these things are already discussed in the RCH program. Child death rate. It is a crucial indicator of age of 1 to 4 years. Infant is 0 to 1 year. Now the next is 1 to 4 years. Again, you will take the population of 1 to 4 years in the denominator, and it is calculated per 1,000. What does it reflect? Poor conditions of young children. If there is a high true death rate, it again reflects poverty, malnutrition, lack of healthcare facility, and it measures healthcare quality also. Factors affecting, again, you know all these things, basic things. And how do we reduce? By improving the healthcare, addressing malnutrition, immunization, improving the access, and creating awareness among parents. Next is under 5. This is from birth till 5 years of age. Again, under 5 mortality rate indicates poor health condition of the country, and it reflects poverty, malnutrition, lack of healthcare. It is a comprehensive indicator of child health and reflects the overall health status of the population. Again, you know, factors affect maternal health, birth weight, access to healthcare, socioeconomic status, and environment. Improve the health, promote breastfeeding, give the immunization, improve the newborn care, address malnutrition, provide good environment, good healthcare facility, and awareness. All these things are, you can use all these common things for all the death rates. Coming to the adult mortality rate, it is from the age group of 15 to 60 years per 1,000 population. Again, the denominator is from 15 to 60 years of population. It reflects overall health, indicates socioeconomic conditions, measures healthcare quality and economic impact also. Factors affecting, here you will have non-communicable diseases, injuries, accidents, suicides, homicides, socioeconomic factors, lifestyle factors, everything, okay, which are not common in the younger age group. How do you reduce? By addressing NCDs, by implementing good lifestyle and interventional programs, injury prevention, combating infectious diseases, addressing socioeconomic disparities, and promoting healthy lifestyles. Coming to the maternal mortality rate. This is a different one. The denominator is 1 lakh live births. It is calculated per lakh live births. That is, denominator is total live births. Okay, number of numerator is number of maternal deaths divided by total number of live births into 1 lakh. Okay, it indicates, if it is low, it indicates poor maternal health and healthcare system, and reflects poverty, inequality, and access to healthcare. Okay, it deficiencies maternal healthcare specifically. Again, factors affecting, access to healthcare, socioeconomic conditions, cultural practices, and underlying medical conditions. Reducing, improve the healthcare facilities, promote family planning, address harmful traditional practices, and strengthen the health systems also. Now we have disease specific. This you can calculate for specific disease. Okay, again the denominator is total population. You don't take total number of accidents happen for accidents. Accidental with total number of accidents, you don't take that. Accidents per total number of population. Proportional mortality rate, it is estimating the proportional deaths currently attributed. For example, coronary artery disease is 25% of all deaths. You have 100 deaths. How much of that is because of coronary artery disease and how much is of sepsis? How much is because of accidents? In India, we don't do this because huge population and getting health data is very difficult. Next, we have case fatality rate. It measures the risk of persons dying from certain disease. For example, of particular disease. Okay, this is expressed per 100 population in the rate. 45% is the case fatality rate of particular disease. If you are exposed to lead poisoning, you might have 10% of the death rate. Okay, if 100 people are exposed, 10 people might die because of lead poisoning. That is the case fatality rate. Years of potential life lost. It is based on numbers of life lost through premature death. If the individual is supposed to live for 80 years and if he dies at 30 years, the life lost is 50 years. Adjusted life. Your death. Who developed it? It was developed by Harvard University and adopted by WHO in the year 2000. It captures the population impact of both important fatal and non-fatal disabling conditions. It is very simple. It not only measures the longevity of life, it also measures the quality of life. This is what DALI is. We'll see how it is done. It is done by two measures, that is years of life lost and years lost due to disability. What does years of life means? It is calculated from number of deaths at each multiplied by expected year remaining according to the global standard of life expectancy. This is the English. Okay. And disability, it is scaled from 0 to 1. Like incident cases due to injury, if someone has lost both limbs, it means it is 50% of the productivity is gone. Quality of life is gone. That means his quality of life is only 50% of 10 if he's living for next 10 or 20 years. It is only 50% of it. If the life is for 10 years after the injury, then the quality of life reduces to 5. If it is 20, it reduces to 10. If you're saying that it is 50% of the disability. We'll see the example. A 30-year-old suffers a road traffic accident and he results in a spinal cord injury that leaves them permanently paralyzed. Okay. When you calculate years of life lost, let's assume the average life expectancy is 75 years. Okay. And years of life lost is 30 years. If he lives only what we say, to live a normal life, he has lost 45 years of normal life. While calculating years of life lost due to disability, if you assume that disability weight is 50%, that is 0.5, okay, for severe paralysis, and assuming the person he lives for 20 years with this disability, okay, that means he is losing 10 years of his quality life. So what is the total disability adjusted life years? It is around 55 disability adjusted life years. Okay. This means the injury has resulted in loss of 55 healthy life years of his life. It is not 45 years. It is 55 healthy life years of time he has lost. Okay. The quantum of living a quality life is lost. That is what DALI is. The importance of DALI is to measure the burden of the disease and to allocate the resources after the requirement of the burden, monitor the progress of the programs, and compare the two nations, who is better and who is not better, and making the policies. These are the 5 importance of DALI in public health. Next, we have odds ratio and relative risk. Okay. What is relative risk? It is just a ratio. Okay. You have 100 population. Okay. Of two groups, 100 and 100. Dengue will occur. People are exposed to one particular disease, and you in group A, and in group B they're not exposed. How many are getting affected by that exposed agent in the group A, and how many are getting the same disease without exposure in the group B? That is incidence among exposed and incidence among non-exposed, two different groups. Okay. For example, there are two groups of people, hundreds are smokers and hundreds of non-smokers. 20 are developing lung cancer in smokers, and 5 are developing in non-smokers. Though the incidence is 0.2 in smokers, 0.05 in non-smokers. So the risk is 4. How do we interpret? This means smokers are 4 times are at higher risk of developing lung cancer compared to non-smokers. There is always a comparison in this relative risk. Coming to the odds ratio, it is the strength of association between the risk factors and outcome. You measure the bonding of the disease. Okay. What are the assumptions for this? The disease investigated must be relatively rare, must be representative of those disease, and controls must be representative of those without disease. There is always a comparison again here also. Consider a case control study of heart disease and high fat diet. 100 people are there in both the groups, for example. Okay. Out of this, 60 are cases who are developing what we say disease. 60 are developing disease who are consuming high fat diet, and 30 are in controls who are consuming high fat diet. Okay, these are developing heart disease and these are not developing heart disease. These are consuming high fat diet and these are not consuming high fat diet. Okay, this means when you calculate the odds ratio, that is cross ratio, you get 3.5 as the answer. How do you interpret this? This means the individuals who are consuming high fat diet are at risk of 3.5 times more likely to have the heart disease compared to those without heart disease. Okay. This means people who are consuming hard. Actually, the statement is a little bit confusing here. The people who are consuming high fat diet are at 3.5 times more likely to have heart disease than people who are consuming low fat diet. This is actually the statement that while typing it, there was a technical error. Okay, this is not the right statement. Significance, it quantifies the risk and it helps in identifying the risk factors which is causing more, and it helps in evaluating interventions, and it helps in prioritizing research and making informing policies also. Okay, next we have the more confusing one, that is concept of standardization, direct and indirect methods in mortality statistics. You want to compare the mortality statistics of two different countries. Okay, now when you take two different countries, their age composition is different, their living type of is different, everything is different. Okay, one country might have older population which has higher death rate because as per the age, and the other country has lower uh, population of the older age group, and their higher age group is in the higher population in the lower age group. So the deaths are comparatively less. Now you want a third calculation or a third parameter to compare these two. This is called as standardization. You take a standard in between and compare these two. X and Y are there, but A is the standard where X and Y are compared with the standard. Okay. How it works? We apply a standard age population to the death rates of each population we want to compare. Next slide, we'll see how it is done. Okay. Now, in the first step, you have country A and country B. Okay, they have different age structures. Now, what you will do, you will take a standard population, that is this. Okay, in this standard population, you will calculate the age-specific death rates for the age distribution. Then you will calculate age-specific death rates for country A and country B. Two are you have calculated as per the age groups. Then you compare the applied standard population of each country with standard population. Okay. Then you will get a specific standardized death rate. Then you can compare both. If what you say, if the standard mortality rate of country is more than 1000, the country has higher mortality rate than standard population when the standard is 1000. If it is less than 1000, lower mortality. If it is equal to standard, then you can say it is same. You are comparing two objects which are not equal with the standard object. This is what is standardized comparison, standardization of mortality statistics means. Okay. The other method of standardization is indirect. In this, we don't have what we say. We have only observed deaths. We don't have the exact calculation. Okay. We'll see how it is calculated. You want to calculate country A and country B, but you don't have any data on age-specific death rates. You just have the raw data. You don't have any other detailed data on that. Now you choose a standard population of age-specific death rates. This could be national population or the global standard. You can take as per your convenience. Then you calculate expected deaths for country B and expected deaths of country A. Okay. For each group, you will calculate this. Okay. And you add all the values of age groups to get total number of deaths in the country B. Then you calculate observed deaths in country B by expected deaths in country B into 1000. Okay. This you do for country A also. Then you calculate with the standard. Here you are calculating the expected deaths with the observed death rates because you don't have the age specific death rates. This is what is standardization, indirect standardization means. That is direct standardization where you have age specific dates. In this, you don't have age specific rates so that you are going with the expected death rates, observed and expected. Okay. Interpretation again, with the standard population, if it is more than 1000, higher mortality. If it is less than per 1000 population, it is lower. Equal to, it is similar to standard population. With this, we'll come to the MCQs. Incidence refers to total number of cases at a specific time, the new cases occurring in a specified period of time, or total number of deaths due to a disease, or the proportion of individuals screened for a disease. The answer is B, the new cases occurring in a specific period of time. Prevalence is best described as total number of cases of a disease in a population at a given time. Okay. Which mortality indicator reflects the overall burden of deaths in a population? It is B, it is crude death rate. Disability adjusted life years measures what? Only the years lost due to early death, the years lost due to disability and early death, the years of productive work achieved by individuals, the difference in life expectancy between populations. It is the years of lost due to disability and early death. It is both. Relative risk is a measure of the absolute risk of disease in population, the ratio of risk in exposed versus non-exposed, the rate of new cases in specified period, association between two unrelated variables. The answer is B, that is exposed versus non-exposed individuals. What does odds ratio is typically used? It is used in cross-sectional studies. Okay. Which of the following method is not a part of standardization? Direct standardization, indirect standardization, weight-based standardization, and age adjustment. It is weight-based standardization. It cannot be done. Case fatality rate measures the proportion of deaths among confirmed cases of disease, the rate of new cases of population, the overall rate of disease in a population, years lost due to premature death. The answer is A. Infant mortality is calculated per 1,000 live births, per 10,000 by live births, or per live births per 1,000 population. It is per 1,000 population. Standardized mortality ratio is used for comparing death rates between two time periods, adjusting death rates based on external, estimating crude death rate, measuring the prevalence of disease. It is adjusting death rates based on external standard population. Okay. With this, we have completed today's class. Thanks for watching Auricle. We have social media handles on YouTube, Instagram, Facebook, and Telegram, and we have iOS app for iOS users and an Android Play for Google Android users on Google Play. Please do download the app and subscribe. Thanks for watching.